Thank you, and thank you, Liz, for that. My name is Julian Bradwell. I am the General Manager for an organisation called Proteus. I feel it's really important to be lucky, actually. I think you have to be lucky in health, and at 52, I've not had a major disease yet, so I feel I'm quite lucky there. I think it's nice to be lucky in love, and I've been married for nearly 20 years, and I've got 3 lovely children. But it's also lucky, I think, to meet people who can help you. And I've been very lucky, and I think Proteus has been very lucky to meet Liz and the NHS team, because it's by meeting people in quite a complex organisation that the NHS is that's helped us to get some of the traction. So a real privilege to be able to say thank you for that. So what I'm going to take you through now is just some background in terms of what the Proteus technology is, where we think it brings benefit to patients and to clinicians, therefore the healthcare system. Show you a little bit about the results and where we're going in the future, and hopefully some of that will provide some thoughts to some of the people here in terms of maybe where we can collaborate further in 2015. So Proteus, as Liz says, we've invented the world's first ingestible sensor. It's made out of foodstuffs, things you can get in your daily diet, bite of banana, a couple of peanuts, some fish. And our organisation turned those base minerals in those ingestible foodstuffs into a uniquely identifiable sensor that, when placed in any oral medication, can identify the time, date, dosage of when that medication was taken. When we think about the implications and the challenges people face in taking medication and the implications for the healthcare system, their own personal health on a long-term basis, we think there's a fantastic opportunity in being able to connect and provide insight in terms of where people are with their own medication-taking behaviour. There are 3 parts to the Proteus system. The ingestible sensor, as we've talked about, tiny grain of sand. The second part is a wearable sensor. That wearable sensor actually detects the ingestion of, you wear it on your side, I've got one on today actually, we can show you the technology if you come to the back of the hall. You wear on your side, it detects the technology when it's taken. It also records rest and activity levels. It's also Bluetooth enabled. So when you swallow your tablet, the patch will detect the ingestion. It'll Bluetooth that information to your mobile phone, and from your mobile phone into the cloud to provide real-time information to family carers, healthcare professionals, and doctors in terms of how are you managing to adhere to the prescribing regime that was discussed with you versus what you actually deliver. Sorry. And the benefits that we think the technology can actually bring is that patients are significantly more likely to achieve treatment goals than patients on usual care. We also think that those goals will be achieved quicker, with fewer resources and less cost, and that those healthcare benefits are sustainable and can be delivered in the first year. And the reason they'll be delivered in those periods of time is because it enables a much more insightful and open and transparent conversation between the patient and their healthcare professional. What is it that you did? How can I use that information to help you in dealing with your health care as we see it today? And we think that conversation is critical in enabling those improved decisions from that healthcare professional. We also see that the availability of digital technology is changing the way that we interact with, interact with our community. And being able to take data and put it into the various systems that are available to the NHS actually closes a major gap in terms of the decision-making process. That major gap is, what did I do with the medicines that you asked me to take? Now at Proteus and lots of the meetings that we have, people get very excited by the technology because of it's clever and it is really simple. But technology is only valuable if you meet the right people. And coming back to my initial statements of working with the AHSN, it was really important for us as an organisation to meet with the right people who've got similar goals, who've got a similar approach, and a real focus around how innovation is going to be adopted across the region. And, oh, sorry, I'll just go back. And whilst we've talked to, like many organisations like ourselves who's looking to introduce and invest within the infrastructure across the UK, we get invited to all the great and the good across the government and the NHS. But what's most important, and so we've spoken to lots of people actually, but we've landed here in the north and specifically with the northwest because of the people that we actually met. And it's because of the people that we actually met, we were enabled to deliver some of the results that I'll show you here. This was a cohort of around 224 patients who had got uncontrolled hypertension uncontrolled hypertension. They were going into their GPs a minimum of 4 times a year, but sometimes up to 6 or 8 times a year, with the doctor trying to understand exactly what it was that was causing their treatment to not allow them to get to treatment goals. So we took those 224 patients, put them on our technology and monitored their medication adherence for that 2-week period. And what we actually found was that 54% or 56% of those patients actually had their blood pressure controlled within the 2 weeks. There was 24% of patients who actually were fully adherent to their medication, but still were out of control. And that gave the doctor 2 really insightful pieces of information. Firstly, half the people he was seeing, up to 4 to 8 times a year, just weren't taking their medication as prescribed. So the conversation that enabled the GP to have was completely different from the one that he'd been having for the previous 12 months. Just the number of potential referrals or appointments that can take out of the system is significant. But they weren't the people that actually the GPs that we spoke to were really interested in. They were really interested in the 24% of people who were adherent to medication, but whose blood pressure didn't get under control. And that's because this person needed something different. They needed something different from their expertise, from the medication that the doctor was prescribing. And potentially, if those people were at high risk, these were people that the doctor needed to take, to take really seriously. So I just think if you're looking at a GP's life, we've suddenly taken, out of every 100 patients that come in with such a chronic disease as high blood pressure, we've got 75% of them who suddenly is really clear about what to do. So the technology that can actually provide that information, I just think is really insightful. Not only for the patient in terms of communicating that actually if I just did what the doctor asked me, I would be safe, I would get better, but for the whole healthcare system in terms of how we manage our capacity. And I think that's what's really insightful about the information, what's really powerful about the technology. But I think we managed to deliver these results. I really like this quote actually, is because whatever you do in life, you have to surround yourself with smart people who argue with you. And it's these people that's really helped on this. And I've got to say, I like the quote, but the argue bit's not what you get from the team. You get a real sense of expertise, a real sense of collaboration, clarity, and an ability to guide an organization like ours, which is American-based, has got very high ambitions and has got interesting technology, who wants to run at 1,000 miles before we've got our tracksuits off. And it's only because of the people that I've got on the slide there that we've managed to make the progress that we've done so far. And the particular element that I'd just like to focus on, because I'm not a healthcare professional by my trade over the 30 years, it's this one piece really. It is, let's keep the patient at the heart of everything that we do. And especially a technology like ours, it is very interesting and people, will come and talk to us about it a lot. But unless we keep the patient at the center of this, unless we keep the healthcare system at the center of technology, then I think we'll struggle to maximise the opportunity. So it's that particular approach that I've really valued from the North West Coast AHSN and the healthcare professionals that they've introduced us to. So, and there's two particular things that we're going to be working on in 2015. And it comes back to, I think it comes back to two areas of how we help the healthcare system manage with the capacity constraints that it's dealing with. And we've sort of titled those really simply, and just for this audience, is we've looked about working with people about setting up a digital ward. A digital ward is where we can take that high number of patients that are clogging up a GP surgery with long-term conditions that potentially will give us complexities over the longer period, but actually are jamming up the system in the short term. And how can we help the system using technology to filter out those people who could be treated in a different place by a different person, and to free up the system in that way? And that's what we're calling a digital ward, and a digital clinic. And the other one we're setting up is something called a digital ward, and that's to try and help people who are being discharged from hospital back to home. And that particular point is, so when people, again, I'm not a healthcare professional, so please forgive me in terms of my layman's technology, but people are discharged from hospital when they're not absolutely well, they're better and good enough to go home. But it's still really important that they are monitored and cared for when they're back in the home environment, because that's the place that people will get better quicker at that particular point. And what, of course, you can do with our technology is you can monitor whether they're taking their medication as prescribed. And if they're doing that, then their disease is going to hopefully be cured over that period of time, and their illness will go away. And also we can monitor activity, rest and activity. So we can see if you're getting out of bed or not in the morning, and if you're walking around, and that information can be trended. So sending that information to a doctor or a nurse that's out there says, patient who went home, probably elderly and fragile, went home, taking the medication on time, getting up in the morning, you know, having a nap in the afternoon, but getting up again, I think is a pretty good signal that person's getting better. And if just that information allows people to triage those at-risk people more successfully, we think it's a real opportunity of how digital technology can be put at the center of patient healthcare. And then my last slide is just about the relationship again that we've had, because we came together about a year ago, and that was a bit of a beginning, and a bit of a beginning of working out where we could fit in within the Northwest. And we've managed to sort of do that and make some great contacts. I was invited here, so thank you, Liz, and I think that's progress, because that says we're keeping working together, and we will do in 2015. But it's working together in 2015 that needs to be a success. And my reach out to any people in the audience here and the people that we've met already is we're keen on working in the same values that the AHSN is, which is about being patient-centered, working collaboratively, but working in a way that introduces innovation that can be built at scale, over a short period of time. Because it's that introduction of new technologies that's going to help our healthcare system over the next 5 to 10 years. So thank you for the opportunity, and thank you for your time.